Hey guys, it's Dan from theclinicaltrialsguru.com again, doing another video. I've been very busy, but keep your questions coming, whether it's through my email, Dan at theclinicaltrialsguru.com, LinkedIn, Twitter, Facebook, whatever it may be. Here's a question, and you will remain anonymous. It says, Hi Dan, one of our ongoing problems is getting paid by sponsors in a timely fashion. We usually have to submit invoices quarterly. They are often ignored for about 6 weeks, then get returned with queries. Then our replies are ignored again. I estimate that the usual time between doing the work and getting paid is approximately 6 months. Okay, excellent question. I've talked about this before, but I cannot repeat myself enough. Do not, whatever you do as a research site, please stop accepting budgets and contracts that pay on a quarterly basis. I've had sponsors tell me that they will not accept anything less but quarterly, but that is generally not the case. I always insist on monthly payments, and in 9 years that I've been doing this, I've only been turned down once, and I still did the study, but it was a pain in the rear end. I still did it, but do not, please, do not accept these kind of budgets with these kind of payment timelines because it makes it harder for everyone else, all the other research sites, to negotiate their contracts. So please negotiate contracts. And in your case, I would go renegotiate this budget. Just tell them, look, we're running a business. These quarterly invoices are ridiculous. They're more like 6 month payment cycles instead of 3 month. And with all the queries and stuff like that, we need monthly payments. Another thing I would do is you said you're submitting invoices quarterly. You shouldn't be submitting invoices for any study visits. At my company and at most research sites, you submit invoices for pass-through costs like transportation fees or hospital bed days or IRB fees or startup fees or things like that. But for a regular visit, like a study visit that's part of the protocol, we don't submit invoices. We're paid based on the data entry and the data review in the CRF, and that's usually done on a monthly basis. And you've really got to have someone to stay on top of this. I used to do it at South Coast Clinical Trials. Now I have someone else doing that for me. It's very important that this is not ignored, and especially when your invoices are getting returned with queries, it is making this is just I can't imagine, but this is a nightmare for you, and you need to immediately, and I mean today, call them up, send an email, send a letter, do all of the above. Complain to your monitor, complain to the project manager, complain to the medical monitor, complain to everybody that it's ridiculous. You're running a business. You need monthly payments for this study, and you need payments to not be based on invoices, but rather based on what you're actually doing in real time as the data is entered and reviewed. This will make life a lot easier for you, and I would just not accept this. Learn from this study for future studies. Do not accept this kind of stuff anymore, please. And don't worry about losing the study or, when I first started, I didn't want to complain too much in this industry because I was just happy to have studies. Believe me, this is a reasonable complaint, and sponsors and CROs, they know you have a business to run. But in this case, they're just buying time, and as long as you accept it, they're going to keep doing it. Don't do it. Like today, call them and get your contract renegotiated and get your payments that are outstanding FedEx to you overnight, ASAP. I've done it, and the squeaky wheel gets the grease, so make sure you do it. Let me know if you have other questions. I mean, you really should do this, and especially all your other sites learn from this as well. Monthly payments, invoices should only be for pass-through items, not study visits. That's a pain. Don't do it. Hopefully it helps. Shout out to my Clinical Trial Guru producers, Sarah Elizabeth Siegler, Resolve Research Solutions, Accurate Clinical Trials, Earhart Clinical Trials, PTNR, Patrick Stone, Sean Kulkarni, Biopharm Systems, Zymwire, Mozio, South Coast Clinical Trials, Breakthrough Clinical Trials, and St. Paul Medical Research Center in Miami, Florida. Thank you very much. Bye-bye.